Hi everyone, welcome to our channel Canadian Nurse Expert. In this video, we discuss about cardiac assessments and critical thinking questions related to the topic. One of the toughest parts of nursing school is mastering cardiac assessments, right? Well, guess what? We're diving deep into a 15-question quiz to make sure you're totally prepared. Let's do this. Alright, question number 1. A nurse is assessing a patient with chest pain. Which question is the most appropriate to determine the quality of the pain? Is it A. On a scale of 1 to 10, how bad is the pain? B. When did the pain start? C. Can you describe what the pain feels like? Or D. Does anything make the pain better or worse? The answer is C. Can you describe what the pain feels like? Asking the patient to describe the pain, is it sharp, crushing, burning? Gives us crucial information about what might be going on. Think about it. A heart attack might feel like an elephant sitting on your chest, while heartburn could be more of a burning sensation. Let's move on. Question number 2. Which physical assessment finding suggests adequate peripheral circulation? Your options are A. Bounding pulses. B. Capillary. Refill less than 3 seconds. C. Absence of edema in the extremities. Or D. Warm skin temperature. The answer is B. Capillary refill less than 3 seconds. Capillary refill time directly reflects how well blood is flowing in the smallest blood vessels. While the other options might be present in a patient with good circulation, they're not always the most reliable indicators on their own. Capillary refill time is your go-to for quick and accurate assessment of peripheral circulation. On to the next one. Question number 3. When assessing the carotid arteries, what is the most important step to prevent complications? Is it A. Palpating both carotid arteries simultaneously, B. Auscultating for bruits with the bell of the stethoscope, C. Palpating one carotid artery at a time, or D. Having the patient hold their breath during auscultation? The answer is C. Palpating one carotid artery at a time. Pressing on both at the same time could reduce blood flow to the brain, leading to dizziness or even fainting. Palpating one side at a time allows us to check for any abnormalities in pulse rate or rhythm without compromising the patient's safety. Great job, everyone. Question number 4. A patient is experiencing palpitations and dizziness. Which assessment finding is most concerning? Your options are A. Blood pressure of 130 over 80 millimeters of mercury, B. Heart rate of 110 beats per minute, C. Irregular heart rhythm, or D. Respiratory rate of 16 breaths per minute. The most concerning finding is C. Irregular heart rhythm. Palpitations and dizziness coupled with an irregular heartbeat could indicate a serious cardiac arrhythmia like atrial fibrillation. Arrhythmias can disrupt the heart's normal rhythm, leading to decreased blood flow and potentially life-threatening complications. You guys are doing great. Stay focused. Question number 5. The nurse auscultates the patient's heart sounds at the second intercostal space, right sternal border. Which valve is being assessed? Is it A. Aortic valve, B. Pulmonic valve, C. Tricuspid valve, or D. Mitral valve? The answer is A. Aortic valve. The aortic valve is best heard at the second intercostal space, right sternal border. Knowing your heart sounds and their locations is crucial for identifying any abnormalities. Practice makes perfect. Let's move on to the next challenge. Question number 6. When assessing the patient for heart murmurs, what technique should the nurse use? Your options are A. Auscultation with the diaphragm of the stethoscope, B. Palpation over the apex of the heart, C. Percussion over the precordium, or D. Inspection of the chest wall. The answer is A. Auscultation with the diaphragm of the stethoscope. Heart murmurs are those extra sounds we hear due to turbulent blood flow in the heart. The diaphragm of the stethoscope is specifically designed to pick up those high-pitched sounds. Keep listening to different heart sounds, and you'll become a murmur-detecting machine. On to the next question. Question number 7. A nurse palpates the apical pulse at the 5th intercostal space, mid-clavicular line. What is this location called? Is it A. Erb's point, B. The point of maximal impulse, PMI, C. the angle of Lewis, or D, the suprasternal notch? The answer is B, the point of maximal impulse, PMI. This is where the apex of the heart touches the chest wall, and it's the best place to feel the heartbeat. Knowing this landmark is essential for accurate cardiac assessment. Great job, everyone! Question number 8. A bruit heard over the carotid artery suggests what? Your options are A. Normal blood flow, B. Increased cardiac output, C. Turbulent blood flow, or D. Decreased blood pressure. The answer is C. Turbulent blood flow. A bruit is that whooshing sound we hear when blood flow through an artery is disrupted or turbulent. Bruits are a serious finding that require further investigation, as they can indicate an increased risk of stroke. Keep it up. Question number 9. A patient is suspected of having deep vein thrombosis, DVT. Which assessment finding supports this suspicion? Is it A. Bilateral ankle edema, B. Decreased blood pressure, C. Unilateral leg swelling, or D. Elevated heart rate? The answer is C. Unilateral leg swelling. DVT is a blood clot that forms in a deep vein, usually in the legs. This clot can partially or completely block blood flow, leading to swelling in the affected leg. DVT is a serious condition that requires prompt treatment to prevent complications like pulmonary embolism. Let's keep going. Question number 10. The nurse notes that a patient has an irregular radial pulse. What should the nurse do next? Your options are A. Document the finding, B. Assess the patient's blood pressure, C. Auscultate the apical pulse, or D. Notify the healthcare provider. The answer is C. Auscultate the apical pulse. An irregular radial pulse could indicate an irregular heartbeat, but we need to confirm that by listening to the heart directly. If the apical pulse is also irregular, then we can document the finding and notify the healthcare provider if necessary. Great job, everyone! Question number 11. What is the primary reason for auscultating heart sounds in multiple locations? Is it A. To assess for the presence of S3 and S4 heart sounds, B. To determine the heart rate and rhythm, C. To evaluate the function of individual heart valves, or D. To identify any murmurs or bruits? The answer is C. To evaluate the function of individual heart valves. Each heart valve has a specific location where its sounds are best heard. By listening in multiple locations, we can isolate the sounds of each valve and identify any abnormalities. On to the next question. Question number 12. The nurse is palpating for dorsalis pedis pulses and cannot find them. What should the nurse do first? Your options are A. Notify the healthcare provider immediately, B. Use a Doppler ultrasound to assess for a pulse, C. Elevate the patient's leg and try again, or D. Document the finding as absent. The answer is B. Use a Doppler ultrasound to assess for a pulse. Sometimes the dorsalis pedis pulse can be difficult to palpate, especially in patients with edema or poor circulation. A Doppler ultrasound uses sound waves to detect blood flow and can help us locate those elusive pulses. Keep it up. Question number 13. The nurse documents a patient's blood pressure as 88/54 millimeters of mercury. What symptoms should the nurse monitor for? Your options are A. Headache, B. Dizziness, C. Constipation, or D. Increased urine output. The answer is B. Dizziness. A blood pressure of 88/54 millimeters of mercury is considered hypotensive, meaning the blood pressure is lower than normal. This can lead to decreased blood flow to the brain, causing dizziness or lightheadedness. It's important to monitor for signs and symptoms of hypotension, as it can lead to falls or other complications. Let's finish strong. Question number 14. A patient is experiencing ankle swelling. What additional symptom would indicate a cardiac cause? Your options are A. Leg pain with activity, B. Shortness of breath, C. Warmth and redness of the ankle, or D. Increased urine output. The answer is B. Shortness of breath. While ankle swelling can be caused by many factors, shortness of breath, especially when lying down, is a classic sign of heart failure. If a patient presents with both ankle swelling and shortness of breath, it's crucial to assess for other signs of heart failure and notify the healthcare provider immediately. One more question. Last question. What is the primary purpose of asking a patient about their alcohol and drug use during a cardiac assessment? Is it A, to judge their lifestyle choices, B, to identify potential risk factors for cardiac disease, C, to satisfy our curiosity, or D, to determine if they need a referral to a substance abuse program? The answer is B, to identify potential risk factors for cardiac disease. We ask about alcohol and drug use because these substances can have serious impacts on heart health. By identifying these risk factors, we can provide appropriate education and counseling to promote heart health. And that's a wrap! High five, everyone. You just crushed 15 challenging cardiac assessment questions. How did you do? Let me know your score in the comments below. And hey, if you found this helpful, do me a favor and smash that like button. Don't forget to subscribe and hit the notification bell so you don't miss out on any future NCLEX study guides. Remember, you've got this. Keep studying hard, stay focused, and I'll see you in the next video.